If you have received medical care recently, you've probably noticed that our medical system is broken. You are no longer in control, and even your doctors and nurses are no longer able to exercise their expertise and best judgment. Insurance companies and government bureaucrats now seem to be in control of everything. People who do not know you and do not care about you are making fundamental decisions about your healthcare. Strange things are starting to happen when you walk into a doctor's office, clinic, or hospital. Quite often, you will be forced to sign forms giving up your privacy and rights before you are given medical service. After going to the doctor, you may receive a bill for some service that you never asked for, never needed, never wanted, and never knew they were even giving you. But there it is, 3 weeks later, a surprise bill for $600 or $6,000, which your insurance does not cover. According to the British Medical Journal, the third leading cause of death in the USA, just behind heart disease and cancer, is medical error, resulting in over 250,000 deaths per year. The rate of injury from doctor error must be staggering. Since the pandemic of 2022, you may be forced, coerced, or pressured to accept certain medical treatments, even though the law says you may never be forced to accept any treatment. In our new technological age of big data monetization, your personal medical history may be shared with people you would not choose to share it with. Your doctor, clinic, or hospital may be fixated on giving you highly profitable but inappropriate treatments insurance companies will pay them for instead of safer, more effective, inexpensive, non-invasive options that you actually need. These abuses have arisen mainly because patients' interests have been marginalized, and patients are often intimidated or unable to express their concerns and needs during medical visits. Surprisingly, most or all of these problems can be flipped if we just take some simple steps to reserve our rights and state what kind of service we require. You can do that by simply presenting a one-page document when you walk into a healthcare facility. You probably already know that healthcare providers often don't give us a chance to raise questions or discuss preferences. We may be too shy to confront those we hope will treat or cure us. What we need is a non-confrontational way to put the doctor, clinic, or hospital on notice, so our personal legal position is on the record. We need a carefully crafted document that puts you back in the driver's seat and addresses how our healthcare system violates our rights, privacy, and financial well-being. We draft documents so you don't have to. With this notice to healthcare provider, you can empower yourself in any medical situation. We offer this fully drafted document free to all subscribers. Simply edit the document by adding some basic information your doctor needs. Then hand it to the receptionist when you visit the doctor, hospital, or clinic. This notice document states you will not pay for any service unless you are informed of the cost in advance and personally approve it. Holds the facility and staff accountable for their mistakes, and you won't pay for services needed to fix those mistakes. Reserves your medical rights and prohibits anyone from pressuring or coercing you into treatments or services. Limits who can view or share your medical records. Prevents the facility from prioritizing insurance reimbursements over practical, affordable treatments, regardless of protocols or kickback schemes. Simply handing over this notice to the receptionist puts the facility on legal notice that you are demanding a certain quality and kind of service. This not only gives you legal standing if your terms are violated, it gives you something tangible to refer to during or after your medical visit. You don't need to feel apologetic for giving them this notice. You are fully entitled to express reasonable patient terms, especially when so many providers routinely violate the law, overcharge, or refuse accountability. When I present this notice, I include my patient information on the same page. I simply tell the receptionist, as a convenience for you, my name, address, birth date, and insurance info are on the form. Would you please file this page with my medical records? I have never had anyone refuse to take or file the notice, or even object. In my view, if they were to refuse the notice, I would not allow that facility to treat me. All the notice does is require the facility to obey the law and respect your rights. If they won't do that, don't let them treat you. If enough of us demand responsible, ethical care, this broken medical industry will be much less broken. Print several copies of the notice and keep them with you. Keep notes on who you gave the notice to and when. Maintain records in case of future disputes with healthcare providers. Doing this gives you a powerful legal position and the protection you deserve. Subscribers to this channel can get the from free by request.